So, Dr. Smith, last week we spoke about liposuction and the dangers of liposuction, but we actually discovered that it's actually very safe. So now we wanted to talk about the differences in the types of liposuction there are.
That's correct. Liposuction is very safe. There are many types of liposuction, but they work basically in the same way. It seems like every time you turn around, someone claims a new type of liposuction that's somehow better than the other. And honestly, there aren't a lot of clear differences between the types of liposuction. They all work in basically the same way. Through a small incision, a little poke hole usually, so it's not a scar that's very noticeable. I mean, tiny little scars. You place some sort of instrument, either a laser fiber, or in this case, you were talking about one of the other things you saw on TV where they freeze the cells, or just stick in the suction cannula and basically destroy and remove the cells. They all work really very similar in their technique. There are certain differences, but in general, most of the techniques are not shown to be clearly superior over the other. It's more that it's a new thing, so people will push this as if it's something new in attempts to get patients. Sadly, it's a competitive market. It's usually not quite honestly, it's rarely actually the real plastic surgeons that do this, because we are very closely monitored by our society, but sometimes some of the people who aren't real plastic surgeons will push that they have some new form of lipo, and really there isn't any forms that really just stand out. Probably the only form that stands out a little bit is laser liposuction, and it's probably slightly better, in my opinion, than tumescent liposuction. That's the safest form of liposuction. So the safest form is tumescent. What that means is pumping fluid into the fat. We've discovered that if we pump a little fluid in first, and it's actually just IV fluid, the fat cells come out with far less trauma. So before we used to just stick those cannulas in and suck them out, and I know that made you cringe, and we would, for every fat cell we took out, we'd lose half a cell of blood, So if you take out a liter of fat, you'd lose half a liter of blood. We couldn't do that very much and couldn't do it. But we discovered if we pump fluid into the fat first, the cells come out actually with far, far less trauma. The recovery time can be very quick. And this is called tumescent liposuction, probably the very safest method of liposuction, probably the very best or next to the very best. The only real advances, I think, of all these many different ways of liposuction is probably the laser liposuction. It probably adds some advantage in terms of skin shrinkage. After we do liposuction, one of the main problems is that the skin does not shrink tight, or may not shrink. It does shrink some, but it may not shrink enough. Using the laser to gently heat the undersurface of the skin, actually kind of a controlled light burn, will tighten the collagen and elastin fibers and get an additional bit of skin tightening. So in some people with loose skin, the laser liposuction actually shows an advantage. All these other forms of liposuction have not seen any real advantage to them.
Very, very interesting. Thank you so much for this information.
Thank you, and thank you for asking me.
For more information or to schedule a free consultation, call 702-838-2455 or email Dr. Smith at smithsurgery@aol.com.